All right. Well, hello, everyone. This is Erin Sinnaeve. I'm a nurse practitioner, a member of the JIVINITI Coalition, and co-lead investigator for Project GAIA, which is ongoing right now. And if you haven't taken the survey yet, please check the link in our bio and take that survey. Anyway, I'm super excited today about who I'm bringing on for our live. Her name is Cody Stubbe. She's a registered nurse with a Master of Science degree in nursing. She is a nursing instructor for Purdue University Global in Lincoln, Nebraska, and for Nebraska Methodist College in Omaha. She is a certified Food for Life instructor with the Physicians Committee for Responsible Medicine and a member of the American College of Lifestyle Medicine. Cody is the founder and president of Holistic Dish LLC, which specializes in plant-based cooking and nutrition classes and incorporating lifestyle medicine into colleges and healthcare facilities. She's doing such amazing work. She hosts speakers for educational events. She is an active member of the Nebraska Organization of Nurse Leaders, and she has also been an online guest speaker on PCRM's Cooking to Combat COVID class series. Amazing. And she has been a guest on Vegan Mainstream's podcast. She is the co-founder and co-director of So Many Cooks in the Kitchen and So Many Kids in the Kitchen. She hosts annual cooking and nutrition classes for PCRM's Let's Beat Breast Cancer campaign in October, and is the co-founder of the annual online holiday vegan Thanksgiving Moss program. Oh my gosh, I'm going to bring you on, Cody. Let me find you. There you are. I hope it works. There she is. Amazing.
Hi, can you hear me?
Hi. Yes.
Okay,
Oh
good.
my
Hi, thanks so
gosh.
much, Erin, for inviting me on today.
I struggled with Thanksgiving Moss, but I'm going to have to get used to that.
I heard that. That's okay. Yeah, you're gonna have to get used to that. So it's gonna be an annual event. And we're excited. We're gonna have a special guest this year, and we might just let it be a surprise. I'm not quite sure what we're gonna do with that yet. We'll see. I got to talk to that guest and see what that person wants to do.
My gosh. And that'll be in November.
Yeah, I'm not quite sure on the date yet. So once we
Okay.
get that all figured out, we'll announce it.
We will
So,
be
but
publicizing that. We'll share it from Divinity and Thrive Plant Life and all the sites. So anyway,
yeah.
well, and I didn't mention in your bio that you and I have been friends before we were even plant-based. We were nurses together in an OR setting in Omaha.
Yep, that was a long time ago, Erin.
Hospital. And yeah,
Yeah.
it's so crazy how that's where we met. And then we, were great friends there. And then I moved away and then we reconnected. But
Mhm.
anyway, it's really nice of you to join us for this live. And I can't wait to hear more about what you're doing. So tell us a little bit about your personal journey going plant-based.
So my personal journey, I mean, it doesn't feel like that long ago, really. It was when, like about a year after I had Nora. So I had Nora a little bit later in life. I was in my 30s. And it was about a year after she was born. And I was doing clinical rotation on a cardiac unit. And we were taking care of a patient that had open heart surgery, and this person was in his 20s. And I was just like, what is going on that a 20-some-year-old needed open heart surgery? Because usually 20-some-year-olds just bounce right back. But this person, no, they had it. They had severe coronary artery disease. And yeah, so they got their chest, cracked open and revascularized. And that's what I used to do. I used to be an open heart surgery room nurse. And so it just kind of like started kind of getting my wheels turning, like, I need to figure out what's going on. This population's getting sicker at such a younger age. And so I started watching some documentaries, and one of the first ones I watched was Forks Over Knives with
Mm.
Dr. Esselstyn, and he's an old cardiothoracic surgeon, so I could really relate to him and his stories. And I watched like What the Health, and me being a nursing instructor, I like to look at the research. So when they start talking about it, I'll look it up online. and just to validate it. And sure enough, I'm like, oh my gosh, why are we not talking about this, about processed meats and the risk of cancer? And, you can actually reverse cardiovascular disease, open up those arteries, not just in the heart, but the whole body. Why are we not having like advertisements about this, talking about
Yeah.
this in hospitals? And so then it just kind of like, okay, well, I switched right away and, went vegan, whole food, plant-based. And within 3 days, I noticed, I had a little extra baby weight from having Nora. And the older I got, the harder it was for me to kind of lose those few extra pounds. And that just like melted off. And then I started having more energy, which was great because then I had, 3 kids and I have more energy. I'm like, oh my gosh, this is incredible. And so I just went with that and just loved it. But unfortunately, I couldn't convince my family at that time to do it along with me. So I was doing some extra meal prep and everything, and it was a struggle. So I know I kind of had some pitfalls and some, but I was just, nope, I got to keep going. And I was like, gosh, for me, it was a lot of work just with the family, but I just kept at it. And then I found the Food for Life program at PCRM and applied. And once I got accepted, I'm like, okay, this is it. Full force, whole food, plant-based, vegan, 100% all the time. And this is what I'm going to promote. This is my calling. And then I got certified, and it was just such a joy. And so it's just my calling in life to spread the message, educate others on the benefits of whole food, plant-based. And we really need to hear that, education, I think, is key on this. So.
Yeah, I mean, wow, what a story. 27 open heart surgery. That's crazy. I mean, and it's so sad because I know in my clinic I see kids that are just sick, unfortunately. And I don't make it about weight, but it's like, because they're growing, but it's like just seeing them, knowing that what they could be in store for if they don't, start to eat a healthy diet. And a lot of it's not necessarily their fault, right? So it is about education, just like you mentioned. And I know one of the things when I was talking to Dr. Furman is I was like, when I was in nursing school, we didn't hear about this. Why? And you mentioned that, right? And so it is up to us. It is up to us to do the work. And I mean, you're doing so much amazing work. Give me some examples of some of the work you're doing to really get the message out. Uh-oh. I hope I didn't lose you. Did
Sorry,
I
I think
lose
you're
you?
freezing there.
Oh,
I
okay.
think
One
you
of us
said
is
something
freezing.
about
Yeah, I know.
examples of
Okay,
the
I'm
work.
back. Yeah, the work you're
It's
doing
okay.
to really get the message.
Okay.
Glad we're back.
Oh my goodness, Erin. So I feel like I am doing just so many things. I feel like this is the year that I'm hitting a lot of my goals, which I'm really excited about. But yet I'm like, oh my gosh, I don't have time for all this, right? Plus raise a family and work as well. But yeah, I'm a nursing instructor. I teach in Omaha. I teach in Lincoln. I teach on right now the cancer unit, which I love. And I teach at a excuse me, long-term care facility too. So I mean, I teach a wide range of different populations. My nursing students, they're a wide range as well, from non-traditional to traditional. We got actually a good, BIPOC population in Omaha and Lincoln. So the Black, Indigenous, and people of color population. So I see the struggles that they're going through as well. And what else am I doing? Oh my goodness. So I love teaching. And I do Food for Life classes, and that's why I'm wearing my pink, because this is, Let's Beat Breast Cancer Month. And so I just finished up a series. I even taught some of my nursing students some of the classes. So that was really fun. And so many cooks in the kitchen, I help out with that. And
That's
so
on
many
Facebook,
kids.
right?
Yeah, and on YouTube. So you
Oh,
guys
and
can look that up.
okay, so we can find you there. Yes, I love popping on Facebook and seeing those events, and you have your kids cooking, which is so amazing.
Yeah, so I transitioned my family about 2 years ago. It took some convincing, and then I think it was once my husband watched the documentary Game Changers. That's
Yes.
when he was all on board because he likes to lift weights and was worried about, I think, that part of it. And he's actually found he's got some great benefits, less soreness, quicker recovery if he does get sore, and I think his muscles are getting bigger. So.
Oh, I love it. Yes,
Yeah.
Game Changers is such a great one, especially, yeah, I get that a lot in clinic too. People who are athletes or they work out, they get really worried about not being able to get enough protein or whatever it is. What are your thoughts on
Right.
that?
Yeah. I know, it's so funny. And then the kids have really embraced it, you know.
Wonderful.
So Nora's been whole food plant-based like already like half her life. You know, she's 5 now, and I think she
Mhm.
was like 2.5, I don't know, 3 when she transitioned, you know, and she's like, I can't even remember what meat tastes like anymore. I'm like, well, that's good. You
Amazing.
know. Excuse me.
No, I
But
love that because, yeah, I know. If I wish that I had known when I was younger, right, growing up about the benefits of plant-based diet. But, we when we learn more, we do better, right? So,
that's correct. Yep.
a lot of evidence that supports it, right? Like around eating a whole food plant-based diet.
Yep. And I figure, just start them early, and then
Yeah.
getting them to help cook as well. I found that do more colorful foods, try those first, and it does take a few times to kind of get them used to these different foods. But just keep at it, get them involved in the kitchen. Eva, my oldest, she's very creative. She's like my little recipe developer,
Yeah.
and I'm just always impressed what she comes up with.
I
And
love.
Ella, she's my little comic relief. She's always giggling at Nora. So the three of them cook together for those shows, and it's just kind of hilarious. I watched
Cool.
the last one. I just was shaking my head. I'm like, oh my goodness.
They have fun and they're enjoying it and they're eating healthy at the same time, which is great.
Yeah.
So let's talk a little bit about COVID-19 because I know
Mhm.
you're partnering with us and you're sharing the survey and all of those things. And we know that some ethnic and minority groups have been disproportionately affected by COVID-19 for a number of reasons, right? And we also know that those that suffer from chronic lifestyle diseases are at higher risk for poorer outcomes. And we're starting to see some COVID nutrition literature emerging that's showing that those eating more plant predominantly seem to have better outcomes. There's not a lot of evidence, unfortunately, which is one of the reasons the study's ongoing to kind of
Right.
see where it is. But what are your thoughts on why is nutrition not being discussed more as how it could help, with COVID and maybe even prevention of poorer outcomes, and especially when people go to their regular primary care provider's office, maybe they're not hearing about this message. Why do you think that's the case?
Okay, so I want to apologize. You're kind of breaking up a little bit in that
Ah,
question. So if you could
I'm
just
sorry.
repeat the first part of it a little bit, I'm so sorry.
Oh no, I'm sorry. And it's probably my connection. I don't know why I've got all the bars, but anyway, no, I was just asking about COVID-19.
Hmm.
Certain groups of people and people that have chronic lifestyle diseases seem to have poorer outcomes.
Yeah.
Why do you think that is, and why do you think we're not talking about it more? We don't see it more in the media or at our regular doctor's office.
Right. So, um, well, this population, you know, they're hit hard with COVID. They have, more chronic diseases, and a lot of these chronic diseases can be related to diet, what they eat, as far as, high fat, unfortunately, highly processed foods, like food deserts can also contribute to that because maybe they only have like the gas station to get lunch at or something like that. And those usually have highly processed foods. So it just kind of depends. But it's just it's hitting them harder, which is it's not
Mhm.
right. So I think this study is going to be very important to kind of bring out some of that information.
Mhm.
I
Mhm.
think, and COVID as well related to nutrition.
Mhm.
As far as and you mentioned nutrition as far as policy level
Yeah,
as
at
well.
the policy
Yeah.
level, or even
Yeah.
why is that not being talked about more?
Okay, so this is interesting because where I live, it's a lot of animal agriculture, right? So this is the way of life out here for people,
Mhm.
raising cattle, raising, growing corn that's going to feed the cows. And so it's a way of life. So we have to be really kind of careful, like sensitive when we talk about that subject. We don't want to offend people because this is their means, right?
Mhm. Mhm.
So yeah, we have to be very sensitive to that. But that the decades of research are showing, that what you eat actually contributes or can contribute or benefit looking at what you eat, of course, but eating a lot of animal products shows that it increases a lot of chronic disease. Um, and people maybe don't want to hear that because, this is their way of life. You don't want to offend them. And it's just, it's very touchy, it really is. So I try to kind of look at it as the healthcare aspect of things. That's
Mm-hmm.
what really got me into it,
Mm-hmm.
because of the benefits of health.
Yeah.
And I guess that's kind of why I've decided to try to kind of reach, the healthcare providers or the future healthcare providers as well, right? So that's why I go into nursing programs. I've incorporated a lot of my Food for Life classes into the curriculum, and providing these Food for Life classes to the nursing staff at the hospitals, and providing educational events. So I'm going to do a film screening in December for Code Blue. That's another great documentary I want to
Fantastic.
mention. Yeah. So,
Uh,
just kind of getting these healthcare providers, and then, like I said, future nurses, because I hope that there's going to be kind of a trickle down effect,
yeah,
to their peers, their family members, and then their patients. So,
I love
um,
that's exactly it. Getting it to the next generation of healthcare provider and and nurses. Yes, 100%. And then they have like first line access to people in the hospitals and clinics, and so you're doing such amazing work. I love that. I love that. So in
thanks, Erin.
conclusion, I mean, thank you again for hopping on, but I'll let you know, just tell us where people can follow you, where they can find you, and add anything else you'd like to add.
Sure. Well, first of all, I want to thank you very much for having me today and let me be one of your supporters of Project Gaia. So thank you very much. You guys can follow me, find me on Holistic Dish, and it's holistic with a W. I also want to mention that not only is food related to health, but food also relates to the climate. So I don't know if this is probably backwards for you guys, but this is Food is Climate. It's a book, and it was written just a couple months ago or published by Glenn Mercer, and it talks about how food actually relates to climate change. And it's very eye-opening. I didn't realize, all of this, but it is just incredible. And it also has recipes in here that are whole food, plant-based. There's actually quite a few Food for Life instructors that are in here. And I must tell you that my daughters and I are in here as well with our own recipes. So
I
I just had to
love
put
it.
that out there. So this is a really great book. It's affordable. But I mean, there's people that get into, eating this way, whole food, plant-based, or vegan for different reasons. Like I said, mine started out with the health aspect of things, but it has since evolved to like more animal rights
Mhm.
and climate change as far as preventing that or reversing it. I think of the younger generation. I got 3 little girls, and they're for all of those things. They don't see the health side as much as that because they're young and don't see all that, but they definitely see the climate change with everything that's going on, and the animal rights, of course. But this book is very interesting, so I highly
Yeah,
encourage everyone to pick up a
we'll
copy of
have
it.
to pick
So
up a copy of Food is Climate and check out the recipe that you and your daughters put together. I love that. Well, you're doing such great work. Oh my gosh, that's all amazing. And I just want to say thank you again for hopping on and all you do to spread the word about whole food plant-based eating for health, the planet, the
oh,
animals, all the things. So,
well, thank you.
um, anyway, yes, everyone follow Cody at Holistic Dish
And
and
please take the survey, everybody. It would really help out Project Gaia, please.
you have the little link in your bio as well, I
I
think,
do.
right? Awesome. Well, thank you so much and have a great weekend ahead. And we'll talk to you soon.
Okay, awesome. Well,
All
thanks so
right.
much, Erin. Take care.
Bye bye.
Bye.